are going to talk about a systematic review and meta-analysis which demonstrates cardio-selective versus non-selective beta blockers for cardiovascular events and mortality in long-term dialysis patients. Trials in patients receiving dialysis have demonstrated that beta blockers reduce all-cause mortality and cardiovascular events. However, differences still exist within class comparative effectiveness studies of the therapeutic benefits of beta blockers in dialysis patients. The main objective of this systematic review is to examine whether cardiovascular events and all-cause mortality differed between dialysis patients receiving cardio-selective and non-selective agents. When it comes to the methods of the study, a comprehensive search of relevant articles from the PubMed, EMBASE, Cochrane, and ClinicalTrials.gov was performed. All adults receiving beta blockers to evaluate the effects of cardio-selective versus non-selective agents on mortality and cardiovascular events in the dialysis populations were included. Hazard ratios and 95% confidence intervals were examined for the negative outcomes of cardiovascular events and death for any reason. Coming to the results of the study, 4 observational studies including 58,652 long-term dialysis patients were included in this meta-analysis. Compared to the dialysis patients who took non-selective beta blockers, patients who took cardio-selective beta blockers was probably associated with fewer cardiovascular events and may have lower all-cause mortality. It can be concluded from this study that cardio-selective beta blockers are probably associated with fewer cardiovascular events and may have lower all-cause mortality in long-term dialysis patients than non-selective beta blockers. But the present study need to be replicated using randomized controlled trials with longer observation durations.